Hi, I am Dr. Mike Latoris. We talked recently on the phone about your HIV test results. The results are in my office. Please step in.
Did you know that every 9.5 minutes someone in the US contracts HIV?
Really? No, I didn't.
Well, I'm sorry to say, but you're not part of that statistic. I see you're shocked. So, do you have a very good understanding of the concept of HIV?
No, I mean, I know a little bit, but not too much.
Well, HIV, which stands for a human immunodeficiency virus, is a disease that affects the human immune system. What it is that during the initial infection, a person might experience influenza-like syndromes. Like, have you felt sick lately or within the past couple of days?
Well, I'm pregnant, so I mean, I always feel sick.
Yeah. Well, you see, the way this disease works is that as the illness progresses, it interferes more with your immune system, and it makes you much more likely to catch other infections.
What do you mean for my baby?
Well, since you caught this late and you are in your ninth month of pregnancy, there's a higher risk of vertical transmission. Vertical transmission is a thing where there's a high risk for your baby to contract HIV through you. Now, since your baby has high risk of contracting HIV, we will most likely start you on antiretroviral therapy.
What's this antiretroviral therapy?
Well, depending on the level of the complications, your antiretroviral therapy will most likely start on you on antiretroviral therapy as soon as possible. Usually, we start a positive pregnant woman as soon as possible, usually around the third trimester of pregnancy. But since you're past this stage, we'll most likely begin as soon as possible, immediately. Now, the drug therapy consists of a 28-day course of 3 drugs. The 3 drugs are an NNRTI, which stands for non-nucleoside reverse transcriptase inhibitor, an NRTI, a nucleoside reverse transcriptase inhibitor, and a PI, a protease inhibitor. Usually we use these 3 drugs in conjunction of a drug cocktail, which you will receive for the next 28 days, and hopefully this will somewhat prevent the risk of contraction of HIV to your baby when she's born.
1 second. Hello? Oh yes, this is Mike Latoris. Yeah, I'll be there later. Okay, talk to you soon. Bye. Okay, so the way we tested for your HIV was through the E1A or enzyme immunoassay, formerly known as the ELI assay or the enzyme-linked immunosorbent assay. The way we confirmed it was through the Western blot, and that proved positive. Any questions?
What does all that mean? What does that measure?
It measures your CD4 count and your viral load. CD4 cells are a type of white blood cell that specifically targets and is destroyed by HIV. For a healthy person, their CD4 count varies around 500 to more than 1,000. Usually, HIV patients have less than 500. Even if a person has no symptoms, though, HIV infection can progress to AIDS when their CD4 count becomes less than 200. Now, viral load, this test measures the amount of virus in your blood. Studies have shown that people with higher viral loads generally fare more poorly than those that have a lower viral load.
Any idea on how you contracted your HIV?
I have not a clue.
No.
Well, Ms. Sapphire, there are actually many ways you can contract HIV. Have you had any unprotected sex other than your spouse over here within the last year or so?
Of course not. I'm married.
What about you, sir?
No, of course not.
You've been cheating on me?
Okay, sir. Have you have you had any recent blood transfusions? Any contact with blood at all within the past year or so?
No.
Mrs. Doubtfire? No.
No.
Have you had any contact with needles, any syringes within the past year or so? Any contact with syringes?
No.
Mr. Doubtfire?
Out of the ordinary.
Well, there was that one time.
Dun dun dun.
Fun, baby.
Alright, you ready, man?
Yeah, you got it?
Yeah.
Alright, man, let's
You know what? You wanna use the good stuff?
go. You know what, man, today? Yeah, let's use that good stuff.
Aight. Aight.
Let's see what you got. Let's see what you got.
I got the good stuff right here.
Let's see what you got, man. Oh!
Oh, it's the good stuff.
Alright. Let's go. Let's get this good stuff. Let's get it on.
Alright, I'll go first.
Alright, man. Tighten you up right here. Yeah, man. Let's go. Alright. Freeze! Let me get some good stuff. Man. Oh, this is some good stuff right here.
Woo!
Unbelievable. I cannot believe you did this to me. What were you thinking? What are you, a moron?
Well, I didn't know.
What do you mean you didn't know?
Well, you should have known. Like I said before, HIV is transmitted through blood and through the sharing of needles. You put your wife, your family, and your unborn baby at risk. In actuality, you should have got tested immediately the moment you shared needles with someone. But now since we're at that point, we'll try to contain the HIV as best as we can with the drug therapy, and hopefully, you know, we'll spare your unborn baby this pain.
Okay.
Oh, welcome back, Mrs. Doubtfire.
Hi, Doctor.
How have you been?
I'm doing well, thank you.
And who's this?
This is my daughter.
Hi, nice to meet you. Please have a seat. Sit down. So, first I have to say, I'm sorry for your loss. I heard about your husband.
Thanks, I appreciate that, Doctor.
So, how's the therapy going so far?
Oh, well, so far it's been 15 years. I have HIV. I haven't progressed to full-blown AIDS. The doctor has me on Retrovir, which makes me sick. And, you know, it's very hard to stay compliant, but I know it's necessary to keep me alive.
Well, the first thing you should always try to be as compliant as possible on the drug therapy. Now, one of the things about Retrovir is that it has a lot of side effects. So you should be aware of side effects such as anemia, nausea, headache, insomnia, muscle pain, or weakness. Have you had any of those side effects lately?
Well, day to day, I mean, they all change.
Well, if you do have any of those side effects, please don't hesitate to, you know, call the hospital and find out, you know, make sure everything's fine. So, who's this?
This is my daughter. Her name is Alexa. She is also HIV positive. Unfortunately, I wasn't able to prevent that during pregnancy.
Okay, we cut right there.
Thank you.
So how are you feeling today?
I feel okay.
Well, we're going to have our resident pediatric guidance counselor, Mr. Yugadima, come in and talk to you. Actually, I think his name walking in right now.
Hi, how are you?
I miss meeting you.
Hello.
Hi, Yugadima. These are Mrs. Doubtfire and her daughter, and you want to have a word with them.
Yes. How are you coping and how are you feeling with your HIV?
Well, I guess it's okay. I have a lot of fevers, a lot of chest pain. The medication that they give me makes me really sick. I don't really want to eat when I'm taking them. Actually, I don't know. It's okay.
Those are usual symptoms to your drug therapy. I'm here to talk to you about prevention of you spreading your HIV to other people.
Everyone in school thinks that I'm going to give them AIDS.
You cannot spread AIDS through normal contact, but there are other ways. I'm here to talk to you about practicing safe sex practices and safer behaviors. Abstain from sharing sexual fluids. Reduce the number of sexual partners to 1. Always use latex condoms, and if you're allergic to latex, use non-latex condoms. Do not share drug injection equipment. And do you have any more questions?
If I have any questions, can I call you?
Oh yes, please don't hesitate to call me. If you need anything, I'll hand you some pamphlets and information on anything that you need. I'll be there for you. Of HIV/AIDS has been diagnosed in the U.S.
There's an estimated of 1.1 to 1.8 million cases in the United States alone.
At 16%, women are the fastest growing group infected by the disease.
40 to 60 million people are infected with HIV AIDS worldwide. 2.2 million are children.
In the U.S. are 53% of men having sex with men and injection drug users at 20%. It's important to know your status and get tested, or else.
Let's do it. You have AIDS.
Yes, you have AIDS.
I hate to tell you, boy, that you have AIDS.
You got the AIDS.
You may have caught it when you stuck that filthy needle in here.
Or maybe all that unprotected sex put you here.
It isn't clear, but what we're certain of is you have AIDS.
Yes, you have AIDS.
Not HIV, but full-blown AIDS.
Be sure that you see that this is not HIV.
But full-blown
It's not HIV, but really full-blown AIDS.
I'm sorry, I wish it was something less serious.
But it's AIDS. You've got the AIDS.